Hello there. My name is Nani Frances Ariahu. I'm a family nurse practitioner. And how are you doing today, sir? So, sir, can I have your name and your birthday? Thank you. I actually see that you're here today for a respiratory examination. So this actually involves me feeling on different parts of your chest with my hands, and I'll also be using my stethoscope, to listen to different parts of your chest and your lungs. Okay, is that okay with you, sir? Okay, good. All right, so this is me just, testing for my patient's mentation. Make sure my patient is alert and oriented. Make sure my patient isn't confused. I would also look at my patient's breathing pattern too. Make sure the patient is not in any form of distress. Patient is not using, he doesn't have any nasal flaring, isn't using, there's no retraction of intercostal muscles. Patient isn't, doing pulse-sleep breathing. Patient isn't using any accessory muscles to breathe. I would also check for my patient's respiratory pattern. For healthy individuals, it's usually from 12 to 20. I make sure, patient is actually breathing well. I would also look at my patient's skin, check for lesions, check for wounds, check for scarring, check for incisions from past surgeries as well. I would also look at my patient's skin color. Make sure there's not any form of discoloration. Make sure that the patient's skin is even, and in my patient's skin, this are all within normal limits. Also, I would also check for my patient's posturing. So I'm just gonna have you sit up, so I can see my patient is actually sitting, not leaning forward, like in cases of patients who have COPD. I've looked at there is no form of thoracic deformities such as kyphosis or scoliosis. So my patient is actually symmetrical. So, and also I would also, as I've looked, I've make sure my patient is barrel chested. I've looked at the symmetry of my patient. So patient is actually breathing in a very symmetrical manner, and patient looks symmetrical. So then I'm also going to assess for patient's chest expansion, and that happens in a way where I have to use my thumb in between, just right underneath my patient's rib cage. Okay, then I have patient, can you take deep breath for me? In this case, you're going to see my fingers going apart, and when I have patient, can you exhale, take breath out, and my fingers come back together symmetrical. So when that happens, that means that actually shows that there's a symmetrical chest expansion. Just seeing my fingers go evenly back and forth during inspiration and expiration. So I'm gonna have you, Mr. Teddy, just have you lie on your back while I just touch parts of your back, okay? Okay. So in this case, we're gonna be palpating for tactile femoris in the posterior back. So this is just, around the, just at the back of the neck, okay. So in this case, I'm gonna have patient say 99 while I palpate with my palms, okay? So Mr. Teddy, I'm gonna have you say 99 anytime you feel my hands on your back, okay? All right, so patient say 99, 99, 99, 99, 99, 99. Okay, this is just me also checking for resonance evenly distributed around the lungs. Now, checking without, and also feeling for dullness or shedding in parts of the lower area of the ribs where you have the solid organs such as the liver and the spleen. Okay, so I can actually, feel for resonance while I have palpated the patient. Okay, so I'm also now going to pick across the patient's chest. It's also me feeling, checking for, resonance throughout the lung. Make sure there is no no fluid in the patient's lungs or any air in the patient's lungs, any form of constellation or anything going on. Okay, so this just involves me taking my fingers and then tapping to feel for any form of dullness or resonance throughout the patient's lungs. Okay, all right. So I'm just gonna feel at the back of your lungs, okay? That's okay. So So I'm going to be comparing both sides. Okay, so next I'm gonna request for diaphragmatic excursion, and this just indicates how the diaphragm moves down during inspiration and moves upwards and during expiration. And so when we calculate the distance between both, it actually gives us the diaphragmatic excursion. And in most every time, the diaphragm is usually located between the 8th and the 10th intercostal space. So in this case, I'm just gonna use the infra angle of the scapula, which would just take me straight to the to the 7th intercostal space, and then I'm gonna precurse downwards, and then I'm gonna have patient ask my patient to take a deep breath in and hold. Okay, right here, I'm just gonna precurse down. See the distance. Okay, so and you relax, and then I'm just gonna mark. Okay, and I'm gonna go and precurse upwards, to be able to find the distance. Okay, so now I'm gonna have it take deep breath in and take deep breath out and hold for me. Okay, now go ahead and precurse. Okay, and then hold. And then relax. I'm sorry. Okay, so when you compare both distances, for a normal healthy individual, it has to be between 3 centimeters to 5 centimeters. And in my patient's case, I see it's about 4 centimeters from when I measure with my ruler. Okay. Okay. So next, I'm gonna auscultate the posterior breath sounds. Just to listen for any abnormal lung sounds, such as crackles, wheezing, pericardial rubs, or rhonchi. Just any abnormal or no lung sound. All right, Mr. Teddy, I'm just gonna listen to your back with my stethoscope, if that's okay. Okay. All right. And this will be comparing both sides. Beautiful. Okay, so from auscultating, I do not hear any abnormal heart sounds. All lung sounds are clear posteriorly. Okay, and so now I'm just gonna go ahead and auscultate for agophony, bronchophony, and pylororquai. Okay, so for agophony, I'm gonna have my patients say E whenever he feels my stethoscope on his back. Okay. All right. This is just to make sure I just want to make sure I don't pick any abnormal sounds, and if I pick anything, maybe like an A, there's actually probably an issue going on, in the lungs. But so it has to resonate, and it has to, sound clear as well. I listen to the patient. So, Mr. Teddy, I'm gonna have you say E while I listen with my stethoscope. Whenever you feel my stethoscope, I'll have you say E for me, okay? All right. E, 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 E. Okay, perfect. Thank you. And that's all clear. And for bronchophony, I'm going to have patients say 99 anytime he feels my stethoscope, okay? All right, so Mr. Teddy, we're just going to do this again, okay? Once you feel my stethoscope, I'll have you say 99, 99, 99, 99, 99, 99, 99. Wonderful, and that's all clear as well. And for bronchophony, I'm just gonna have patient whisper, 99, and just so I can just see how clear it sounds in my stethoscope. So Mr. Steady, I'm gonna have you just gently whisper 99, okay, while you feel my stethoscope again, okay? That's for the pectoral B. Sorry. And so I'd have you say 99 in a whisper fashion. Just whisper while I listen to your lungs, okay? And all lung sounds are all clear, and this concludes this aspect of the posterior chest examination. Thank you.